So tell me, what is your primary cancers that you're seeing in the practice?
Now, one cancer is really outstanding, and this is the osteosarcoma.
Osteosarcoma.
And I know why that is. When your dog gets diagnosed with osteosarcoma, conventional veterinary practice has not much to offer. There is first the limb amputation, right, just to take the pain away. Osteosarcoma is an incredibly painful cancer, poor souls, but it also spreads rapidly.
It's very aggressive, isn't it?
Very aggressive. So when you in veterinary practice, it all goes much faster than in humans. You know, when the dog comes in, presents with the problem, they get into surgery very quickly if owners decide to go for this. But even if you have surgery a few days after the diagnosis, it might have already spread, and so the outcome, even with an amputated limb, is not very good.
It's
not very good. I have not much experience with chemotherapy and radiotherapy in osteosarcomas. We haven't done that in practice, but what I can read up, it's not. They cannot give much hope, even going down that route. And of course, it is. You don't want to make the last days of a patient miserable. You would rather enjoy, having a good time.
Life. And I think it's important for owners to understand that our dogs and cats or animals don't understand disease like we do. Like, we understand, that there's going to be a death at some point and a parting. But our animals don't have that degree of consciousness about it. They have a consciousness in terms of feeling pain, and they feel the fear, and they feel the fear of your fear. But from their perspective, and the sadness as well, they do feel that. And of course, any pain will, of course, make them feel sad and obviously quite depressed. So when I'm talking to clients about chemotherapy with their pet, it's important to recognise that we're not putting our own emotions and our own desires into the animal's experience, because the animal actually is experiencing itself just as it always has done, with maybe a little bit of a sore leg. That's basically what it is. And once you start putting chemotherapy into the mix, those sorts of medications are incredibly debilitating, aren't they? I mean, they do have quite significant side effects. So there is a lot to weigh up there, and it's a very individual choice, as what we say for people who are experiencing cancer as well. So let's break down a little bit what we think's happening with cancer. So cancer, as far as what we're concerned, is pretty well much the origins of cancer is the same as any kind of disease process as far as we're concerned. We don't differentiate cancer as being this thing outside over here that doesn't have a relationship to what else is going on in the body. And that's because we see everything as interconnected. And so the origins of cancer are the same as the origins of any disease. So, okay, so did you want to extrapolate on that?
Yes, I mean, if we have this cake, what contributes to diseases, the biggest chunk is diet.
Yep, okay.
That counts for animals as well. Then we have this chunk of toxins, the environmental pollution. Everything what we eat is not clean. Dog goes for a walk on land that has been sprayed. That all adds. Then also treatments, anti-parasitic treatments.
That's
the
right.
The regular use of anti-parasitic treatment contributes to the overall toxin load. Then emotions play a role in the development of disease. Stress, lack of exercise. Then you have your genes. It's probably just a small. It's
small
a small part. Could be argued about.
Yeah, well, it depends on which research, and this is where, if you've been watching any of these series where I've talked about the Otto Warburg theory, the metabolic theory of cancer, and the genetic origins of research, and how back in the 40s there was a decision was made to follow the mapping the genome, and that the genome became the magic thing to try and work out, but actually it hasn't yielded since the 40s, so over 40 years of research, it hasn't yielded the information that they were hoping. And the reason that was the case, just for, they could patent genes. They could create this biological treatment and patent the gene. So, I mean, there's no money in not patenting something. So that's where the research money goes, unfortunately. So that's why the idea of this holistic approach has been given such a wide berth, because no one can really make a lot of money out of it. That's the reality, unfortunately. But from our perspective, we don't mind, because we're happy just to exist in a more normal world. We don't need to be billionaires. So we can just be a little bit more normal about what we're doing. So let's talk a little bit then about the types of dogs that would be susceptible to osteosarcoma.
Usually it is the large to giant breeds, but I get more and more smaller ones. And I have the feeling, yes, of course, we have this global clientele, and we get whole lot more cases than the normal general practice.
Particularly in the US, we do see a lot of dogs in the US with osteosarcoma. In fact, we would be getting 2 or 3 inquiries a day at least on that condition alone.
But even when you are in small animal practice and you have a radius of, let me say, 30 kilometers, you will get them very, very regularly.
Oh, yeah, right. Okay, that's interesting. And do you put that down to maybe environmental impacts?
I think everything has
just
a
everything
role to play.
Yeah.
Everything. When you're talking about the giant breeds, then probably the genes are coming in.
Yeah.
And now we get medium-sized and sometimes even small dogs.
I know. And I'm seeing it in horses as well.
I had a cat.
Oh, really?
With osteosarcoma, one cat with osteosarcoma. I think this cancer seems to
it's becoming, so there's obviously something happening in our environment that is obviously impacting, and I think we can safely say that number one is diet.
Yes.